Positioning the patient on the side. This skill helps to treat and prevent skin breakdown. The patient should be turned at least every 2 hours. If not done frequently, it can cause skin breakdown, poor nutritional intake, and poor hygiene. You will need 1 small and 2 large pillows. You have 3 to 4 minutes to complete this skill.
Hello, Miss Keisha. I'm going to call and be your caregiver today. I'm just going to check your wristband. Someone's going to position you over on your side, get you off your bottom for a couple hours. Is that okay?
Yeah.
Okay. So go ahead and put the bed up to waist level. Touch your back. If the head of the bed is up, you want to go ahead and put it flat. So I'm going to put the head of your bed flat. Okay, go ahead and walk to the other side of the bed and put the side rail up and give her some privacy. So there are no side rails in long-term care in Washington State anymore, but for testing purposes, we want to do this for safety to make sure the patient doesn't fall. So I'm going to go ahead and close the privacy curtain. Okay, I'm going to go and wash my hands and get my pillows, and I'll be right back. So wash hands, simulator for state. Grab the pillows. Remember, don't put anything up against your body. You don't want to cross-contaminate. You want to hold it away. So go ahead and put them on the table. Okay, so I'm going to have you to scoot over to me. So when you have your patient scoot over, you want to put your hands under, one under the hip, one under the shoulder, and you want to guide the patient over. So go ahead and scoot over to me. All the way over. Once your patient scoots over, you cannot move. This becomes a safety issue, so you want to stay right here. Okay, so I'm going to take the arm farthest away. We're going to put it above your head. Just make sure that she doesn't lay on her arm when we roll her over. Then we're going to take a small pillow. It's going to have her to hug the pillow, so you want to place her arm across the pillow. And then I'm going to reach under the sheet. I'm going to bend your knees up. So go ahead and bend your knees. And then you want to just kind of, once again, put your hand near the hip and butt area and the shoulder. And on the count of 3, I'm going to roll you over. I always give the patient a count of 3 when you move them. So 1, 2, 3, turn. Okay. And just untuck her from the covers a little bit. You want to scoot the head pillow over. Very important to adjust the head pillow. Make sure that's comfortable. Okay, so now, a lot of times facilities do not use incontinent pads anymore. But if they do, you want to make sure, scoot it up a little bit. So if they do, you want to make sure that the pillow goes under the incontinent pad. So if the patient soils, it soils the pad and not the pillow. So you want to take your hand and gently push your patient over a little bit. You want to make sure the pillow doesn't go up beyond the shoulder blades. So push it over just a little bit, tuck it, and then you can just kind of roll it in like that. And then bring your patient back over. That way it keeps them from laying back on the back side. You want to go ahead and make sure your patient's not exposed. And so now I'm going to expose the bottom half of your body so I can show you how to cushion the knee and the ankle. So keep everything else covered. So we take the pillow again and we go at the same angle as the foot, that's the knee and the ankle. So we're going to lift your leg up, pillow in. Just make sure the knee doesn't touch and the ankles don't touch. It goes at a straight line. Now we're going to go ahead and cover you back up there. Tuck your sheets back in, get your patient nice and neat. Okay, we're going to go to the other side of the bed. I'm going to go ahead and bring your collar light around. We're going to put it under the pillow. Again, you don't want to go across your patient's neck. And I'll fix that when I get there. So I'm going to go around and put the side rail back down. The side rail is only there for the procedure. Once the procedure is over, we're going to go ahead and put the side rail back down since there are no side rails in Washington State. Make sure your patient's shoulder is covered so she's nice and comfortable when she's sleeping. And here's your call light. Go ahead and hang on to that just in case you need me. When I'm finished, I'm going to go ahead and move the privacy screen while I'm over here. Okay, so I'm going to come back over. Go ahead and adjust the covers a little bit so everything's nice and neat. Okay, Miss Kanisha, I'm going to go ahead and put your bed back down to the lowest level for safety. You comfortable?
Mm-hmm.
Okay. So So you have your call light, the privacy curtain is open, the bed is down in the lowest, safest position. Is there anything I can do for you before I leave? Okay, I'm gonna wash hands, simulate for state, document the procedure. The skill is complete.